Yeah, welcome to our YouTube channel, Wisdom Official, a channel that gives you latest news and documentaries. Today, we are going to talk about another virus spreading in China, Hmpv. Hmpv, another outbreak in China. Will we end up facing lockdown due to Hmpv? Please follow us for more information. First of all, subscribe to our YouTube channel, Wisdom Official, to get the latest news and documentaries. While cases are climbing in China, the situation is very different from what it was when COVID-19 emerged 5 years ago. Hmpv is common and decades old. Reports of a surge in cases of respiratory virus in China have evoked dark echoes of the start of the COVID-19 pandemic almost exactly 5 years ago. According to the medical experts, despite the surface similarities, this situation is very different and far less worrisome. The Chinese cases are reported to be infection with human metapneumovirus, known to doctors as Hmpv. Here is what we know so far. First of all, what is Hmpv? It is one of the several pathogens that circulate across the world each year, causing respiratory illnesses. Hmpv is common, so common that most people will be infected while they are still children and may experience several infections in their lifetimes. In countries with months of cold weather, Hmpv can have an annual season, much like the flu, while in places closer to the equator, it circulates at lower levels all year long. According to the New York Post, Hmpv is similar to a virus that is better known in the United States as a respiratory syncytial virus, or RSV. It causes symptoms much like those associated with the flu and COVID, including cough, fever, nasal congestion, and wheezing. Most Hmpv infections are mild, resembling bouts of the common cold. But several cases can result in bronchitis or pneumonia, particularly among infants, older adults, and immunocompromised people. Patients with pre-existing lung conditions such as asthma, chronic obstructive pulmonary disease, or emphysema are at higher risk of severe outcomes. In higher income countries, the virus is rarely fatal, while in lower income countries with weak health systems and poor surveillance, deaths are more common. Then, how long has this virus been around? The virus was identified in 2001, but researchers say it has circulated in humans for at least 60 years ago. Though it is not new, it doesn't have the name recognition of influenza, COVID, or even RSV, as Dr. Ray Howard said. Dr. Ray Howard is an associate professor of pediatric infectious disease at the Vanderbilt University Medical Center. One reason is that it is rarely discussed by name, except when people are hospitalized with a confirmed case of it. Dr. Howard said that the clinical features are really difficult to distinguish from other viral illnesses, and we don't routinely test for Hmpv the way we do for COVID, flu, or RSV. So most infections go unrecognized and are chalked up to whatever respiratory thing is going around. You can ask, how does a person get infected? I think you are asking yourself how a person get infected with Hmpv. Right? The virus spreads primarily through droplets or aerosols from coughing or sneezing, through direct contact with the uninfected individual, or through exposure to contaminated surfaces. Basically, the same ways people get colds, flu, and COVID. Yeah, that's how this disease is also transmitted, or someone can be infected in that way. Again, is there a vaccine or a treatment? Is there a vaccine or a treatment? Currently, there is no vaccine against Hmpv, but there is a vaccine for RSV, and research is underway to find a vaccination that could protect against both viruses with one shot. Since they are similar, it is possible that the researchers will come up with a vaccination that will work on both diseases. There is no antiviral treatment specifically for Hmpv. Treatment focuses on management and symptoms. Then, what is China saying about it? What is China saying about this outbreak? The Chinese authorities have acknowledged that Hmpv cases are increasing, but have emphasized that the virus is a known entity and is not a major concern. The coronavirus that causes COVID-19 was a new pathogen, so people's immune systems had not built up defenses against it. At a new conference held by China's Center for Disease Control and Prevention on December 27th, I mean this year, the last year, 2024. Kan Biao, the director of the Center's Institute for Infectious Diseases, said that Hmpv cases were rising among children 14 years old and younger. The increase was especially notable in northern China, as he said, and the influenza cases have also increased, as he said. Cases could spike during the Lunar New Year holiday at the end of January, when many people travel and gather in large groups, as Khan said. But overall, Mr. Khan said that judging from the current situation, the scale and intensity of the spread of respiratory infectious diseases in this year will be lower than last year's. Official Chinese data shows that Hmpv cases have been rising since mid-December in both outpatient and emergence cases. Emergence cases, according to Xinhua. Xinhua is the state news agency in China, there in China. Some parents and social media users were unfamiliar with the virus and were seeking advice online. The outlet said it urged calm and ordinary precautions, such as washing one's hands frequently and avoiding crowded places. In a routine media briefing on Friday, last Friday, a spokesperson for the Foreign Ministry reiterated that cases of influenza and other respiratory viruses routinely increase at this time of year, but that they appear to be less severe and spread on a smaller scale compared with the previous year. Chinese officials said last week that it would set up a monitoring system for pneumonia of unknown origin. It will include procedures for laboratory to report cases and for disease control and prevention agencies to verify and handle them. The state broadcaster CCTV reported this. So then, what has the public response in China been? Online, amid comments from people saying that they had never heard of Hmpv and expressing concern that it was a new pathogen, state media outlets have sought to reassure people, warning them against blindly taking antiviral medications. Some users have cracked jokes saying that they could finally use up the masks they had stockpiled during the coronavirus pandemic. Many commenters has discussed a general uptick illness, not just Hmpv. Why does the flu hurt so much? Was trending on Weibo, a social media platform, on Monday last week. Yeah, it was trending. So, what does the World Health Organization say? The WHO has not expressed concern. As Dr. Margaret Harris, a spokeswoman for the organization, cited weekly reports from the Chinese authorities that showed a predictable rise in cases. She said that as expected for this time of year, the northern hemisphere winter, there is a month-over-month increase of acute respiratory infections, including seasonal influenza, RSV, metapneumovirus. Then, should I worry? Should I worry for this outbreak? The reports coming from China are evocative of those from the first confusing days of the COVID pandemic, and the WHO is still urging China to share more information about the origin of that outbreak 5 years on. But the current situation is different in key respects. COVID was a virus that spilled over into human from animals and was previously unknown. Whereas Hmpv is well studied and there is widespread capacity to test for it. There is broad population level immunity to this virus globally. There was none for a COVID. A severe Hmpv season can strain hospital capacity, particularly pediatric wards, but does not overwhelm medical centers. However, it is also vital for China to share its data on this outbreak in a timely manner, as Dr. Sanjaya Senanayake, a specialist in infectious diseases and associate professor of medicine at the Australian National University, said. These include epidemiologic data about who is getting infected. Also, as Dr. continued saying, Dr. Sanjaya said they will also need genomic data confirming that the Hmpv is the culprit and that there aren't any significant mutations of concern. Yeah, thank you. This is what we this is the information we have so far on this outbreak. But according to media houses, the reports that have been shared, the outbreak is not as serious as the COVID-19 was, and there's nothing to worry. We hope that it will be handled in a timely manner. Thank you for being with us. Please subscribe to our YouTube channel, Wisdom Official. On this channel, we will share the latest news. We will give you documentaries that cover different topics, either politics, finance, lifestyles, education, health, and so on. Yeah, thank you for watching. Thank you for being with us. Have a blessed day.